Thank you, Blaine. Today we are back at Mahikeng Provincial Hospital, where yesterday health workers at the maternity unit downed tools, saying they fear for their lives after a doctor tested positive for COVID-19. This morning they have conversed here at the very same facility, saying they want to be addressed by their different unions together with the hospital management, just to know, to be enlightened actually about what is the way forward. And to hear more about that, I am joined by DENOSA representative, Mr. Monokezi. Mr. Monokezi, please do tell us, why are you guys gathered here today?
Good morning, Kia, and to your viewers. We are here today to give workers feedback in regard to what we will have discussed and agreed upon with the management yesterday. We came here to the hospital to quickly engage the management to say they need to come to a conclusion and make sure that they address, as workers were so anxious yesterday about what will have prevailed on Monday up until now.
Some of the things that the workers were complaining about yesterday is that they were told to go back to work, to start working as normal, even without being tested. Have they been tested so far, or has there been any communication with regard to that?
With regard to that, management committed yesterday that they will start immediately with testing every worker who happened to have came into contact with the said worker who was working here. So all of them will have to be tested. They don't have to be any reservations for it. All of them has to be tested.
All right. After being tested, what happens? We understand that the MEC yesterday announced that the maternity unit will be closed for decontamination. But then what happens if workers don't test positive, they test negative? What happens? Are they going to be sent to other facilities, or will they come back after the decontamination? How is it going to work?
What will have happened is that we care for the safety of workers and that of the patients as well. As a nurse, I will say from that point of view, that first and foremost, we need to make sure that all of them are safe. Patients that will have been in those affected units, your maternity, your theater, your gynecological unit, and so on, they need to be moved. They've already been moved to other areas, and we appreciate that the management will have implemented that. And then what will have happened also is that after disinfecting the whole area, that will have started yesterday, and then workers will go home and be quarantined for a period of at least 14 days. And then afterwards, we expect them, depending on the condition, to then return back to work. But what will then happen? We said to the management as DENOSA that they must make sure that there is a relief staff that will make sure that services at those particular units are not hampered forever.
As you heard that the DENOSA representative explaining to us that the lives of their members are very actually important, and therefore they will make sure that they come back to work as soon as they know it is safe to do so. It is back to you in studio for now.
Kia, just talk to us with regards to the contact tracing. How far have the health department officials gone with regards to that?
As the MEC indicated yesterday, Blaine, that they are actually busy with contact tracing at this moment. It means the contact tracing still continues even today, I should believe so.
All right. Kia Demil Lucy, thank you very much indeed for your reporting live for us in the Northwest.